So here we are today with Krista Brown, who I actually met through Instagram. She has a wonderful platform in which she helps to advocate and educate women in the genetic space, as well as in advocacy, as well as in cancer education in general and nutrition. So welcome, Krista.
Hi, thank you. Thank you so much for having me.
Oh, it's my absolute pleasure. I've been really looking forward to our conversation. How are you doing today?
I'm good. How are you?
I'm good. I heard your earphone dropped into the sink this morning.
Yes, it's been a morning already. It's
That
life.
always happens. Always something happens. So I wanted to start with basically if you could just tell our audience a little bit about yourself, who you are, and how you got into the space that you're in.
Sure. Yeah. So my story really begins with my mom's cancer diagnosis. She was diagnosed at age 48 with stage 3 breast cancer.
Mm-hmm.
At that time, she was tested for the BRCA mutations only, which were the only mutations we were testing for at that time. She was negative. So she went through 12 years of every kind of treatment you can think of. And then, luckily, shortly before she passed away, somebody offered her expanded genetic testing for all the mutations linked to cancer that we knew of at that time. And she was positive for a pathogenic variant in her ATM gene. So,
ATM.
um,
Are you going to
yeah.
tell us what
Mhm.
ATM is?
Yeah, ATM, it's very similar to the BRCA mutation. So ATM is a tumor suppressor gene, and so a very similar risk to like BRCA, which most people know about or have heard about at least.
Sure.
Um, and yeah, so most of the time it's considered a moderate penetrance gene or a moderate risk.
Mm-hmm.
However, our variant is the more rare variant, and it is pathogenic. And so my risk was 69%. Well, when I also tested later on and found out I was at risk, 69% risk of breast cancer, 5 to 10% risk of pancreatic cancer,
Mm.
and a 2 to 3% risk of ovarian cancer. And men also who carry this gene have a risk of prostate cancer. But yeah, so
Wow. So tell me a little bit more about your mom's journey after she had her testing done. So you said she got chemotherapy because she actually already had breast cancer, right?
yeah, she was at when she was tested, it was like only 3 or 4 months before she passed away. So at
Mm-hmm.
this point, she was preparing to go on hospice. But um,
Oh,
yeah, she went
sorry.
through chemo, radiation, endocrine therapies, all the
Mm-hmm.
things. So it was
Wow.
not easy and definitely eye-opening. I'm a nurse. I've been a nurse for I think 13 years now, and
Wow.
so it was definitely a learning experience for me.
That must have been
Mhm.
so hard. How old were you when she was sick?
So she was 48, so I
Hmm.
was like I don't
You
30.
don't know. You're 30?
Yeah,
You were a
30.
kid, right?
She was yeah, young, yeah,
Yeah.
newly married. Mhm.
Wow. That's really tough.
Mhm.
So then you went ahead and got tested, and
I did.
that sort of formed the basis, I think, of what you've been doing, right?
I did. Yeah, so if your parents carry one of these mutations, you have a 50% risk of inheriting it. So yeah, I decided to move forward with testing and
Mhm.
yeah, it was positive. Mhm.
So if you don't mind me asking, you never personally had cancer, you're just preventing?
No, I did have cancer. So
Oh, you did?
so my, genetic risk actually led to my diagnosis, which is why I'm such a huge advocate for genetic testing.
Mm,
I so when you have a high risk mutation, they, recommend that you have more increased, thorough screening. So
right.
I was alternating every 6 months between a mammogram and breast MRI, and so
Wow.
I started screenings and then considered the, option of a preventative mastectomy. So I was planning that, had my surgery in place and had an
Mhm.
MRI come back showing an abnormality. So that led to further testing. They told me it was a lymph node. I had 3 specialists tell me it's not cancer.
It's not
99% sure this is
cancer. This
is
isn't
not
cancer.
cancer.
Not cancer.
Yeah, but I pushed for a biopsy because it did impact the order of my surgery. I chose a mastectomy with deep flap reconstruction, and so it was
Mhm.
impacting the whole process. And so I pushed for a biopsy, and sure enough, got diagnosed 2 weeks before my preventative mastectomy. So,
Unbelievable.
but it was early, stage 1A, which I'm
Mhm.
very grateful for. And
Sure.
one of the reasons I think genetic testing is so important, especially if you have a family history, because
Sure.
that's what led to my early diagnosis. And,
R
as you know, Tiffany, like the earlier cancer is found and treated,
Yep.
the better the outcomes, right?
So,
Mhm.
just out of curiosity, because I'm sure people will want to know this, were you diagnosed on a mammogram or on an MRI from that initial
No.
spot that they didn't think was anything?
Yeah, so my mammogram was clear. I have the lowest breast
Mm.
density, A, A breast density, so clearest picture you can have, right? So that was clear, and then 6 months later, I had an MRI, and that was the MRI, that was when they saw the, abnormality, that they thought was a lymph node. So, yeah, so
Unbelievable.
that was the first, yep, and then it followed up with diagnostic mammogram and ultrasound. Ultrasound was also clear, they couldn't find anything. 2
Mhm.
ultrasounds, they didn't see anything. And so, um, you know, the likelihood was, they really believed it was not cancer at that point, which is understandable, but, um,
No, it's
you have
not.
those gut feelings, you have those gut feelings,
Yeah.
and so, yeah, I pushed for a
Ah,
biopsy and
good for
yeah.
you for advocating for yourself, and thank God that you had
Mhm.
the testing to so that you got that higher level screening. That's really
Yeah.
important for people. So, tell me how you've morphed this into helping other people.
Yeah. So, I, as a nurse, I already love educating patients and had never worked in an oncology setting at that point,
Mhm.
but decided to share what I learned. For me personally, I really feel like the more knowledge you have, the more empowered you are as a
Knowledge is
patient, and
power.
yeah, it is. And so, when I found out about my genetic risk, I took lots of classes, but most of them were things that you had to have some kind of medical license to get into, right? And so,
Mhm.
and the more I learned, the better or more empowered I felt as a patient. And so, and so many times I remember just thinking, I wish somebody would have told me this. And
Mhm.
knowing that there are so many people that don't have access to that information, I just
Yep.
felt this overwhelming responsibility to share what I was learning with others. And
Right.
so that's kind of where I started my social media. And then one thing led to another. And the more I talked to people in the community, the more responsibility I felt, right, to share. And so ultimately ended up leading to a master's in medical nutrition. And then recently this year started working as an oncology nurse navigator. And um,
I love that.
yeah, it's
That
been really good.
I think nurse navigators are some of the most important players in oncology treatment. And I was actually just at a conference last week. It was called Health Key. And in
Mhm.
that, we were speaking to government officials, to insurance company like representatives, to advocacy groups. There were all level and business investors, venture capitalists, and they asked me what I thought the number one missing piece was for cancer patients to make it easier for them and to improve their outcomes and as well as improve their ability to get the care that they need. And I said,
Mhm.
nurse navigators. I think
Oh
a
yeah.
medical navigator, from what I've seen now that I'm outside of, academic medicine,
Hmm.
patients are just they're floundering. They don't, you get a diagnosis and you don't know what to do. You don't know who to call, you don't know what to do, and once you do get in somewhere to an office, you need somebody to help explain the system to them and to help advocate them getting the care that they need in a timely fashion. So tell me a little bit about some of the cases that you've worked on.
So, obviously they're different. I don't work in a specific type of cancer, right? There are a lot of
Mhm.
specialists that specialize, breast cancer or something, but in the healthcare organization that I work in, it is all types of cancer. And
Mhm.
so,
Well, that's
um,
it's all generally about, moving through the system. It's not your role. It's not the
yeah,
role of the navigator to give the specific chemotherapy regimen that they're supposed to get. And
right.
so, really,
Oh,
I
yeah.
think that it's completely reasonable that you can be spread across all types of cancers. So, I'm sorry, I
Yeah.
didn't mean to interrupt.
Oh, no. You're totally fine. You're totally fine. So, yeah, I tell all my patients in general, like I get to meet every new patient that comes into the clinic
Mhm.
and go over like all of their medications that are being recommended. And I'm kind of like their bridge to the provider during that time, which I love and get
It's
to
great.
walk, next to as a survivor, right? You
Mhm.
think too, like it's been very rewarding to be able to give back, you know, to others
Mhm.
in walking through that same um
Sure.
but, just for example, one patient that I had recently, there are so many that just stay in your mind, as I'm sure you know, like, they just stick with
Oh, I
you.
know. Yep.
Yeah, so, um, just in general, I had a patient who, um trying to think. Sorry.
Let me ask you another question. What do you
Okay, I know, I'm
find
trying to think of a
is
good one.
the most difficult point of access for patients that you're helping them with as a navigator? Where do people get stuck the most?
Well, okay, I think a lot about the hereditary cancer space as a
Mm-hmm.
mutation carrier. So one of the things that I think, or one of the big gaps that I see in our healthcare system in general is the access to genetic testing prior to cancer diagnosis, right? We're doing
Right.
great in an
Sure.
oncology setting with genetic testing, and I think every patient that I have, it's been recommended genetic testing if they have a family history, especially
Right.
depending on the type of cancer. But at a primary care level, we're not getting patients tested, and so the goal of genetic testing, right, is to prevent and diagnose at earlier stages if possible,
Right.
especially with high risk patients.
Sure.
But yeah, but a lot of patients are not even being offered genetic testing and have no clue that it's even an option for them prior to diagnosis. And so, something that was
So
an issue for
why do
me
you
too.
think I'm going to pause here for a second, if you don't mind.
Sure. Yeah, sure.
Actually, you know what? I'll just let it keep running and we'll have to cut it out. There's something wrong with my camera and it's super blurry. Do you notice that I look
I
blurry?
see. It does look a little blurry.
It's so
Yeah.
weird. And I don't really know how to fix it. Why would that be? Why is it blurry? Maybe it's just a fixed angle. Does that seem better?
Yeah,
Still blurry.
it does look a little better now.
It wants me to be closer, and I don't want to be closer. It seems to have trouble adjusting. There's like nothing on here to adjust, so I'm not really sure what to do. But I look blurry right there.
Is it just like auto focusing? Is it trying, like, maybe not auto
I think so, but I'm glad we didn't do this live. I have another camera. Let's see if this one comes out. This one looks better. Clean the lens off. Yeah, there's no where to focus on this thing. All right, give me a second.
Okay, that's fine.
I think I noticed this before and then kind of forgot about it because I do a lot of these live and then, oh crap, you're gonna have to wait 1 second.
Okay.
Sorry.
You're fine.
Dry cleaning pickup, and I knew the dogs wouldn't stop barking if I didn't go up there. Okay. My studio's in the basement, so.
Oh yeah. We don't have
Yes.
basements in Arizona. Well, very few basements in Arizona. So
If you saw
thing
what
I
the
wish
rest
we
of this
had.
room looked like, I just carved out like a little corner and hung up my
Yeah,
degrees and stuff.
that's what you have to do sometimes.
All right, is this better? I don't think it
Yeah.
is.
I think it's less blurry on my end, but
All right, we're gonna go ahead anyway. I'm gonna get over it. Okay, so rewinding, what we talked about was I was going to ask you about, I'm going to go on and talk about cascade testing then.
Okay.
Okay. All right. So go. So, Krista, I know that you had a diagnosis and your mom had a diagnosis, and you got tested because your mom had gotten tested. And so I think they call
Mhm.
that cascade testing or something. What do you know about
Mhm.
that?
Yes. Yeah, cascade testing is important, and I think it's one of um, the way to make the biggest difference when it comes to
Mm-hmm.
hereditary cancers. And so for me personally, I reported my family history every year at my OBGYN and family practice doctor for 12 years, and no one ever offered me genetic testing.
Wow.
My mom was the first diagnosed in our family, and then later on,
Mm-hmm.
her mom was also diagnosed. So I had two generations of breast cancer in my family that I was reporting, and was still not offered genetic testing. And so, um, um, I had to request it myself, which
That's
is
wild.
happening.
Why don't
Yeah,
doctors not
so
test for that?
I think there's just a big gap in knowledge. Genetic testing has come so far in such a short period of time,
Yeah.
and we're learning so much that if it's not a patient population that you're typically working for, it's not information that I don't think providers are getting. And I've
Hmm.
had the conversation with my primary care and my OBGYN, because even the paperwork in clinics are saying, have you been tested for the BRCA mutation? So for
Right.
me, that was a barrier to care, because
Hmm.
my mom was tested for BRCA, and so I could answer that question confidently, right? Like, yeah, she was negative, and so there was no concern. But we know of so many other
Oh,
mutations, like there's so many types of cancer now,
right.
right? Colon, pancreatic,
Right.
prostate, breast, stomach cancer. There's so many cancers now with genetic links that
Right.
I just think we as patients have to be advocates for ourselves too, and that's one of the reasons I try to share this information.
Sure. So, I actually was at a different conference for breast cancer a couple weeks ago, and Mark Robson, who is the head of the breast medical oncology department at Memorial Sloan Kettering, and also is runs the
Mhm.
genetics as well for them, and he was talking about how some of these new panels that are available have like 40 something genes or even more in them, and that it's
Oh
it's
yeah.
actually a little
Mhm.
problematic because a lot of those genes we don't know a lot about. And so you end up getting a lot of what they call VUS, or variant of unknown significance. And then you don't really
Mhm.
know what to
Mhm.
do with those. So he was talking about the fact that, we really should probably be sticking to testing for the genes that we know how to manage, or we know what we're looking for. And so those panels have more like 9 genes in them, right? Like the breast and the ovarian cancer ones would capture the ATM and some of the other very important
Mhm.
genes. What are the other genes that you like to recommend that people get tested for?
Lynch syndrome is a big one, and actually more common than even the BRCA gene, which a lot of people don't know. I think it's like 1 in 279, I believe, people, which is more common
And that's
than
the
BRCA. So that's a big one.
P53? No, that's Cowden's. Which one is for the
No, that's like MSH1.
right?
Yeah, so there are a couple genes that fall under the Lynch syndrome umbrella, but
Mhm.
increase the risk types of
Right.
cancer, like cancer is a big one,
Hmm.
pancreatic, a lot of GI cancers, but even some breast, some melanoma, so there's a lot linked to
And
that.
endometrial. I used to see ATM,
Endometrial,
I'm sorry, MSH1
yes.
and 2 abnormalities in patients with endometrial cancer as well. So yeah, I
Yeah,
mean, just you don't have to be just having a family history of just breast or ovarian cancer to need to be tested. You're right. So
yeah.
a family history of colon cancer and a uterine
Mhm.
cancer, and then maybe a pancreatic cancer. They're not necessarily unrelated. And so I
Yeah,
agree. And so
and I
what?
would
Go ahead.
I was gonna say, and I would say, just to comment on what you were saying about the VUS, so that's one that you can find, like, that's just, like, you could have a VUS in your BRCA gene or any of
Hmm.
these genes, right? It just stands for variant of unknown significance, which means that we know that it's different than, what we typically find in, like, a patient with no mutation, but we just don't know what that means yet, right? So,
Right.
a
Unknown
VUS is
significance.
something you
Right.
can be on a registry for.
Right.
Yeah, but you can sign up for registries, and they follow your gene over time and will update you as we're testing more people and getting more information. And most of those turn out to be nothing, right? Um,
Hmm.
but but something that they follow for a while until we know more. So
Right.
I don't know. As a patient, I think I would like to be tested for all of the genes. Most of them do have like more screenings with
Right.
them.
Right.
So I don't know. just my opinion, I would like, and some patients have 2 or 3 different mutations linked to different types of cancer. So, I don't know. I'm
Right.
like a huge advocate for like full panels.
Yeah, I think it really matters, and maybe it needs to be the patient's choice as long as they're
Hmm.
educated on what the information that they're going to get that may not be actionable at the time. But you
Definitely.
happen to be a very proactive type of a person, and
Hmm.
not everybody's like that. I've learned that
True.
after years in medicine that, I used to say that every exam room that I walked into is a different world because some patients want to hear everything. Some patients really just tell me what I need to know. Don't give me any bad
Hmm.
news. Tell my daughter. It's like so
Yeah.
many different ways that different people manage their stress, especially surrounding risk of cancer or actually even
Yeah.
treatment of cancer.
Hmm.
Um, so that's really very interesting. So let me ask you some other questions. What do you know about how would you suggest that we improve our advocacy so that people know that they should be getting genetic testing? Have you had any work with that? I know your platform is very
Yeah.
educational.
Well, I mean, I do a lot of volunteer work with hereditary cancer organizations, like
Mhm.
Force. Have you heard of Force? The Facing
No,
Our
tell me
Risk.
about it.
Yeah, they're a great hereditary cancer organization. One of the first I found when I was diagnosed with my high risk mutation, with reliable information, because it's hard to find reliable information
Mm,
on the internet sometimes, especially when we're
right.
talking about social media. But Force is incredible. They do a lot of patient advocacy work. So I do. They have a lot of different volunteer opportunities, but one of the things I do is called patient advocacy leader, and so we work at a state level to create change in policy that will benefit
I love
hereditary
that.
cancer patients with like screenings and coverage and things like that. And then also recently started as a research advocate for them, where you get to, um, I guess, give your voice and like ways that we can improve research in this patient space. So for
Sure.
hereditary cancer, um, so that's a big thing.
That's
What
really
was your
important,
yeah.
except, I'm gonna go back to the fact that you had personally reported to your own physicians
Mhm,
multiple times about your family risk, and it
mhm,
still didn't trigger anybody for sending you to genetic testing. And I want to harp on that for a second because it
mhm.
sounds like a place where we could, even the two of us together, could potentially make a difference. What if we
Mhm.
could make a course that was based for primary care physicians on who and when to test? And sent that
Yeah,
out. It just seems to be basic information. Perhaps some of the physicians that are practicing just they were trained before the era of big time genetic testing and don't really appreciate the importance or the extent in which it needs to be advocated for. So
yeah.
I
I
don't know.
agree that it needs to come from our primary care level, right? And that's where
Yeah.
the younger generations are. That's the only, if they even have a primary care doctor that they're going to see on a
Right.
regular basis, like that's the only doctor that they typically see, right? That when you're young
Right.
and healthy. And I think um, definitely
Hmm.
something where a space where we need change is that primary
Yeah.
care. Um, but yeah,
I
implementing
like
that's
this. I
the
like this
tricky.
idea. I think we're going to talk offline about this and we're going to make something. We're going to make something together. We're going to make a difference. So let's change gears a little bit. Tell me about your master's degree in nutrition and how you're utilizing that to help patients and
Sure. Yeah.
yourself.
So for me personally, when I got my results, and like you said, everyone's a little different, but the first thing that I asked my doctor when I got my positive genetic test results was, okay, now what do I do? What do I eat? What can I do? You know, w- we are at it. This community is like, sorry, let's stop. Let me restart that. Um, so the first question that I asked my doctor when I got my genetic test results was, "What do I do now? What do I eat? Like, how can I reduce my risk?" And other than screenings and surgical options, we aren't really given a whole lot of information. And
Right.
so, I am somebody who likes to have action steps, and I needed something. I think we all kind of just need something to hold on to and feel like we have some control when we're
Absolutely.
faced with these situations where it feels totally out of your control, right?
Right.
And so for me, I started digging into nutrition. I've always had a passion for nutrition and
Mhm.
seeing what a difference it makes for patients in an acute care setting.
Mhm.
It's clear that it makes a difference, but I wasn't sure where to even begin. As a
Right.
nurse, and I'm sure, like as a medical provider, like we get basic nutrition information, but I feel like there's so much more that we're missing out on. And so
Uh-huh.
that kind of triggered my desire to learn more about nutrition. And so I went back to school. I went to Arizona State University and got to focus on a cancer. Like it was population specific. So I chose cancer risk.
Mm-hmm.
And
Mm-hmm.
so, yeah, so I love it. And I felt like so empowered by my food at that point that I like sharing and teaching about that.
So do you do actually personal nutrition consults for patients with cancer?
I don't, I just do education.
Do
Hmm.
education. Okay.
Yeah.
So
Um,
tell me, 3 or so things that are most important for a patient that has cancer
mhm.
actively. What should
Yeah.
they eat? What shouldn't they eat?
So, in general, the recommendations are whole foods. Whole foods tend to tip the scale in our favor. And when I'm talking about whole foods, I mean foods that are as closest to their natural form as possible, right? So, I like to say fill your plate with purpose. So, finding foods that um, filling your plate with like plant-based foods is really a big part of it. And I don't think
Mhm.
necessarily that you have to be entirely plant-based, but the more plants you're putting on your plate, the better. And so I also advocate for like more color and variety in your diet.
Mhm.
Each one of those colors represents different, I guess, anti-cancer nutrients like
Mhm.
phytochemicals and things. And so they're impacting cancer pathways in different ways. And
Right.
so more color, more variety, the better.
And what about proteins? How do you recommend people get protein?
Yeah, so I mean, I there is some research, right? Like obviously, red meat has been linked to cancer, especially colorectal cancer,
Right.
and so limiting that as much as possible. Processed meat is a class one carcinogen, so avoiding things like bacon, deli meat, hot dogs.
That
I
killed me. Can I tell you in practice, you if we weren't ordering lunch, which is happened to be one of the highlights of our day, around 10 o'clock in the morning, we decided we needed to order lunch. And then, it would be the big, but what are we going to have? What are we going to order? But other than that, I normally would come to work with a stupid deli turkey sandwich.
Mhm,
One slice of
mhm.
Swiss cheese, deli turkey, some mustard on whole grain bread. And I thought I was being
Yeah,
healthy. Do you know how much
yeah.
deli meat I've eaten? Hmm.
I know, and that was actually one of the big ones for me. It's like hard. I love sandwiches, right? So that was a hard one for me.
Yeah.
Yeah, but so I mean, avoiding those kind of things is important. But
Are there any deli meats that you can eat? Any ready to eat meats that are out there? Or you got to grill
uh,
your own chicken and salmon every day for lunch?
yeah, yeah. I don't know of any that
Mm,
um are considered like safe when it comes to cancer, right? Like it's just a
right,
general recommendation.
right.
And I think it's there's a lot of different theories on like what the reason behind that is,
Hmm.
but it's not a clear. There's no clear answer at this point in time. So we just know
Yeah.
that it increases risk. Yeah.
Darn
Another
it.
big one is alcohol.
Mm,
Obviously that's also another class one carcinogen, which a lot of
right,
people. I'm always surprised how many patients I talk to in clinic don't know that.
right.
Even like some of my coworkers are like, "Wait, what? Alcohol increases your risk of cancer?" And I'm like,
Yeah.
"Yeah, yeah, significantly, right?" And so,
Hmm.
yeah, of several types of cancer. So, yeah, that's a big one. And then fiber, and everyone thinks that is more of like helps you have regular bowel movements. Kind of like that's what everyone thinks of when they hear fiber, but it
Hmm.
has so many actions, right? It binds and helps our bodies excrete estrogen, and there's a lot of benefits like gut health and all kinds of things. And so,
Hmm.
fiber is one of the only things that I count in my diet every day.
Really?
So,
And how much
yeah.
fiber do you recommend people try to get?
Yeah, 25 to 35 grams, so like 30 on average is
So
a
how do
good
you get
place.
30 grams of fiber? What do you eat to get 30 grams of
Oh
fiber?
my gosh, I start my day most days with chia pudding, which is so simple and so easy to prep for like busy people. Like I'm working, right? So I just have a grab and go. So I have like it's just basic chia seed pudding, and that the one that I have, and I've actually shared that on my Instagram. That the recipe recently that it starts my day with 33 grams of fiber just from that one meal.
Done.
So I'm like, yeah, I'm done. I'm done for the day, and it's so easy.
Huh.
You just throw some fruit on top or some like walnuts. Yeah, yeah.
All right, Krista, we're going to have to extract that recipe from you. Maybe we'll put it in the show notes as well.
Yeah, yeah.
Great. And so how do you feel about supplements? for
So I have
nutrition?
mixed feelings on those. I think that they can be beneficial if they're used in a targeted way, but in general, right, supplements are not something that are highly regulated, and
Mhm.
so we don't have a lot of information, especially for patients who are going through treatment,
Right.
right? Like, we don't have a lot of information on, how those are impacting, outcomes in patients, how they
Right.
interact with chemotherapy and other therapies that you, might be recommended. So, in general, I say unless you need them, don't use them, but I don't
Yeah.
currently
I
yeah,
generally
currently,
tell
I don't
patients while you're on chemotherapy, unless, other than maybe magnesium and vitamin D, I don't usually recommend that you take any additional supplements because we don't know how they interact with the chemotherapy. And like you said,
yeah.
it's not a regulated industry. And so, yeah,
Yeah,
it's
unless
a
there's like
touchy
a
system.
known deficiency, right? Like if there's a
Right.
known deficiency that's different, obviously like anemic patients are gonna need iron and things like that. But like in general, like you should try to get your nutrients from your food.
Yeah, yeah. Which sometimes, if
Hmm.
you're on chemotherapy, for example, it's hard to do. If you have a
True.
bad appetite or you have mouth sores or you're just
Hmm.
nauseous all the
Hmm.
time, it's hard to get balanced nutrition.
That's
So
true.
sometimes I do. Are there any like whole protein shakes that you like? For example, there's one I like called Kachava. I think it's called
Oh, I
Kachava.
haven't heard of that one.
It's
I
good.
haven't heard. No, I
Well,
don't
I
do.
like it, but
Yeah, I make a lot of like my own like smoothies and stuff at home, but I don't have any like store bought recommendations. I don't know.
mm-hmm,
Yeah.
mm-hmm.
That'd be a good I'm sure, like, the dietitians and stuff would have better ideas
Sure.
about those. Mhm.
Yeah. No, that's a good point. But and water. How much water do you try to drink a day?
Yeah. Oh, I am a big water drinker. I also run, so I probably drink more than the average person, but, I mean, in an oncology setting, I don't know in your practice how you do it, but, our recommendation is 64 ounces or more a day, especially if you're someone who's going through treatment.
Right.
But for me so, they say drink half your body weight in ounces, that's, like, the general recommendation. Um,
Right.
I think
You froze, Krista. Krista, you
I don't know if
froze.
you can hear me. Was
Okay.
yeah, it said
That's okay.
connection was lost. I'm sorry. Yeah, so in general, I say you can really tell a lot by your pee, right? So make sure.
Right. Right.
Yeah, yeah. So
Check your pee.
your pee should be clear yellow. Yep.
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 And right. It
That's
shouldn't be
kind of how
muddy. It
you
shouldn't
know
be
like what
brown. It
your
shouldn't
body,
be
your
thick.
personal.
Right.
I know.
No,
I'm
I've
sorry. I'm a
said that to
nurse, so
patients
that
also.
yeah.
It's patients will say, "Oh, no, 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 I'm drinking a lot." What color's your pee?
Yeah, yeah, yeah,
Or
exactly.
then
I
I'll get
know.
a
I know.
chemistry
Some people
panel
think
on
that's
them
weird,
and
but
I'll
I'm
see
like,
their
no, it's the
BUN
best way.
creatinine's elevated. I'm like, I can tell you're not drinking enough.
Mhm.
So yeah,
Yeah,
that's
yeah.
tough. And I always used to recommend getting some sort of a vessel, a container. You fill it up in the morning. If it has 64 ounces in it or something. I like my water really cold. I put ice in it. I like those
Yep.
steel bottles, what have you.
Mhm,
Fill the whole thing up. When it's done,
mhm,
fill it up halfway again, and then you've had enough water. I think that a lot of people come in and they say, "Oh, I had like
mhm.
four of those bottles." Well, how big is the bottle? Well, I have four
Yeah,
16-ounce bottles. Well, that's
yes,
barely enough. It's barely enough. So, people are not really keeping
yeah,
track of how many glasses or
yeah,
bottles that they're actually drinking. So I think that's a little tip for everybody is to
yeah,
just get a vessel that you can drink out of
definitely.
all day long. So, all right. Well, this
Mhm.
has been
Yep, just sip on it
phenomenal
throughout the day.
conversation, Krista. What parting things do you have to say to everyone? What would be the number one takeaway that you would like to say to our audience, which includes both patients as well as patient advocates, caregivers? We have some physicians that watch this. So, what would be the one piece of advice that you would like to give?
Well, I would say I think when we're talking about genetic testing, a lot of people have this fear around it, right? Like you don't want to know. Like even for me in the beginning, you're like, I really don't want to know because when you get a positive result, you kind of feel like your whole life is just like laid out in front of you. You know what you
Yeah.
think you know what's going to happen. But the more I've learned, the more empowering it has been to me, especially as a mom of three kids. And I think it's important to understand that it's just data, right? I tell everyone, all my patients, I'm like, this is just data. It's like knowing your vitamin D level, right? Like,
Right.
if we have that information, we can adjust and personalize care based on your specific needs. And so, I don't know, it's so important, and I think it can be scary, but also, um, empowering, and it could truly save your life. So,
Wonderful. This has been an absolute pleasure, Krista. Thank you so much for spending so much time with us. I really enjoyed it, and I hope to talk
thanks
to
for
you
having
soon. We're
me.
going to talk about our
Mhm.
little primary care project. Okay.
Okay. Thanks,
All right.
Tiffany.
Thank you. Great
Have
seeing
a
you.
great day.
I'll see you
Okay,
soon. Bye.
bye.